Yes, and there are those biomechanics and there are those biotensegrity. It's just that it's not in our mainstream training of OBGYN. But this is something when the birthing body going into, from pregnancy to birthing, these are all designed in our evolution, in human evolution. We really should see that these physiological adaptations to pregnancy and birth, and what a medical provider should be deliver is how we support these functions.
Hello, Jade. How are you?
Lindsay, it's like sleeping time here.
Well, thank you for being awake and for coming on. We are so grateful, to connect with birth workers changing the paradigm all over the world. So in Taiwan, you are practicing OBGYN. So I would love to hear, just take us through your journey and maybe what birth culture is like where you live. Because I think there's people all over the world having different experiences.
Right. Actually, in Taiwan, we had people don't know about midwives, not to mention about doula. Like they're like, right. So because for the recent 20 years or so, no, it's already 35 years because our government somehow abandoned the midwifery education.
Oh, wow. So just no midwifery education.
No midwifery education then. But then they discover there's still need in midwifery. So, and also the old developed midwives, they also claim for their rights and also claim for the women's rights about having a midwife attending their birth. And so it resumed the midwifery training, but for the general population in Taiwan, they've already lost what kind of service midwives giving, or is that really backward, outdated, and not a developed world should be like. People have that kind of impression in Taiwan. And so sadly, in Taiwan, the birthing environment is really heavily medicalized, like somewhat like in the US. But I know in the United States, after the listening to mothers, the um, the statistics they collect from California in say 2002. So that's when the government started to listening to the mothers and started to analyze the condition of birthing in the United States. But in Taiwan, even though the evidence is accumulating and showing to limited the all these medical interventions, especially I take episiotomy, for example, because it's already been in the guidelines that an episiotomy should not be used routinely. But still, when I took my residency training in 2007, the episiotomy rate was above like 95% or so.
Wow,
And so,
that's really
right,
high.
that's really high. It's like
It's like
almost
almost
like a
everyone.
routine.
Yeah. It's
Right.
basically everyone
And
you go in and you get an episiotomy while you're giving birth. Does this also a really high epidural rate with that or not as much? It's variable?
Epidural rate is escalating as well. Like for there, I don't have formal statistics,
Totally.
but I know about like 80% or so, 80 to 90% they're having an epidural. And so there's also a most recent statistics that it shows us like 2 years ago, because we're still advocating. We also have an aliens that claiming rights for women and concerning their birth, and they do the survey, and episiotomy rate is still around 73%.
That's, yeah, still
So
very, very high. Yeah,
yeah,
I think I
still
can't
very
remember what
high.
it's like supposed to be, but I know midwives with like a 2%, right? Or like a 1% rate, right? And I wonder if it's like when they're doing it, what's the belief? Is it like this is going to make the birth safer, or it's going to make it quicker, or like why does it, I mean, I know once things become routine, they're just a routine. But what's the, like, what do you feel? I know this isn't like stats, but what do you feel is like the underlying like belief around giving everyone an episiotomy?
Actually, there's our professors teach us about episiotomy, and they believe that with the cut, it's easier to repair.
Okay.
And yeah, and it will help prevent a more severe laceration. That's in their belief.
Got
But
it. Okay.
we can see, yeah, but we can see from the research, it's
Yeah.
not really the case. And especially, um, I feel when attending birth, because as an obstetrician, I have in my residency about I would say 800 cases of attending normal vaginal births, and also cesarean section altogether. But you can feel the atmosphere is all filled with anxiety, and so OBGYNs need to get this tough part ended soon, as soon as
Yeah.
possible.
Yeah.
Yeah.
That sounds stressful for everyone
Like that.
involved, right? Just
Right.
like
Right.
higher injury. And we also know the stats really do show that more episiotomy is actually more harm to the pelvic floor and to the tissues than maybe thinking about different things. So do people tend to birth on their backs then mostly? Or like what tends to be like birth positions? Like how is that supported?
Right. That's not supported. I have to
Okay.
say, it's not until recently that I think I am one of the OBGYN that supports a free positioning during
That's
giving
really
birth.
cool. Yeah. So what does that, so people, so that's cool. Let's talk about, I mean, it's like, oh, there's a lot of change to be done. So what does that look like? How, like, how do you practice maybe different than others? And what does that look like?
Hmm. It's in a really tough situation actually, because when we started to advocate about every woman should be having a birth plan or preference, and it's actually the association of OBGYN, they're kind of fighting against against
Of
these
course. Yeah. Yeah.
things. Right. Yeah, but later on they feel like, okay, if this is what people want, and so they have a mini version of birth preference. Yeah, but still, because when people go into the hospitals, they still need to follow all the hospital protocols, and it's not that easy to provide a birthing environment that supports women to be in whatever position they want,
Yeah,
because it's
especially so
just
if they don't, the woman hasn't been taught that. It sounds like it's very ingrained in the in the culture to trust the doctor, but also to not maybe like, yeah, that can be a tricky thing to go into, especially like when it's new, right? It's like, oh wait, I can do different birth positions, but why would I want to, right? Like maybe that's part of the thing, is like you can't give somebody something if they don't know to ask for it. So it's this like,
Mhm.
it kind of falls on both. Like we need the game-changing OBs like you who are like, yes, do it in any position, and then we need the families to
Yes,
advocate for their own like
right,
desires. And then we need the
right, to be
educators to
ready
come
for it.
tell them, here's your options maybe, right? Because people don't know. If you don't know your options, then maybe you don't feel like you have them.
Right, and it never comes to their mind, and so in the first hand, I think, okay, let's trust our body, but then then we kind of to see that, okay, but our bodies are also adapted to a modern life.
Yes.
And also in facing birth, they have not much information, and even talk about their own body experiences. Most of the people, especially Asian women, we are taught like from we're little girls not to touch, not to feel, not to explore.
Yeah, so that would be hard to be embodied in this process that's so embodied. It's so about like the sensations of your body and working with them. So so what have been some turning points for you? Like I know this is a lot to work in. This is like like to be like the game-changing OB that's like, no, we need things different. So how are things progressing now? How do you see the future in Taiwan of birth? And like, hopefully we're bringing more people into this paradigm of understanding how to support the physiology, training the people. Yeah, what's your vision or hopes or whatever comes to your mind from that question?
Oh, the vision or hopes.
Yeah.
This is the most typical one, yeah. Because for me, because I have my own pregnancy and birth actually leads me to go out from a hospital point of view. But there are many OBGYN, even they are women, they're giving birth, but they're totally convinced in the medical training we're having. But um, so what I try to do now is to really to get the evidence, like try to communicate in a medical way that
Yes.
everything should be like evidence based. Yeah, so it's really good that in BRM program when I see all these ideas and concepts and they have references that I can search, I can look for, and yes, and there are those biomechanics and there are those biotensegrity. It's just that it's not in our mainstream training of OBGYN. But this is something when the birthing body going into, I mean, from pregnancy to birthing, these are all designed in our evolution, in human evolution. I mean, we really should see that these physiological adaptations to pregnancy and birth, and what a medical provider should be delivered is how we support these function, these physiological function to work, and we are supporting and helping when we can, but not to not really an authoritative role about diagnosing this one and that one and controlling everything. Although I understand that in a hospital setting, because it's always our logic, our rationale is always based on monitoring, risk stratification, and we'd rather be really strict on our regulations. We don't want to miss anything. So the total idea is different. Yeah, but I understand because especially the environment when when birthing person, they are I don't know if I can use that word, trust too much in an OB. They feel like um but OB-GYNs are not gods.
Right, they're
Medical
humans. Yeah.
doctors. Yes, we're not gods. We're human. And we should always go back to what a birthing body should be working and how have we been using our body, like what had lead us to the state we are right now. And if I have been if I have been working with the dissociation from my body experiences, I think that would be rather hard for people to really had an idea that it's actually the pregnancy and birth. It's actually like a stress test to our system.
Yeah, that's
Yes,
true.
so we really should. Yes, we really should have this view turning inward to our own self in talking about a preparation for pregnancy and birth. Yeah, it's not about, oh, leave it to the hospital. You just go to the hospital and the doctors will
Save
guarantee
you or
100%
yeah.
safe. Yes,
I love that.
right.
And what you're really talking about is empowerment, right? It's like personal empowerment. That person giving birth needs to own that. This is like their transformative journey to becoming a parent. And so just outsourcing that to someone else, like is whatever, but it's so much better to learn how to be like the parent you're supposed to be able to stand in your, in your power at birth. And I love what you said about earlier on. You said something about the data, and I think that's the cool thing that I really find important is like we have all this knowing, and I think this knowing isn't new, right? Midwives have known, to reach the arms up to open the bottom of the pelvis forever, right? In the Better Birth Pro series, I show Cleopatra, right, a depiction of her birth, and you're like, oh, they knew this. They didn't have the data that we now have, like we can show that the thoracolumbar fascia like nutates the sacrum. And so that's something we can bring to the doctors, right? And be like, hey,
Exactly.
this isn't just like, well, not that you need evidence, but it's like, no, we can prove this. This is not like Lindsay's weird idea. This is like science, right? And so I
It
think
is, exactly.
that's what, and if that's what's needed, right? If that's what's needed to help shift things, like let's bring all the data we can because we know that this will make birth safer, right? It will make birth more empowering. It will, decrease injuries, right? Versus, putting it all on the doctor, which like you said, you have special training, but you don't have special powers. None of us do, right? We're specialists, but yeah, we don't know. The thing is, we know a lot about birth, but we don't know what's going on with that human, right? That human knows their self better than we can, right? And that's the same of like mother's intuition. Why does a mother know to rush their child off to the hospital sometimes, and the doctor's like, wait, oh, I wouldn't and it's the same thing with birth. I feel like if we can really start learning how to trust ourselves in this stage of the journey, I think it will make us trust ourselves more for the rest of our lives. So I really think what you're doing and what we're doing is so important beyond just a safe birth. It's like setting families up.
Right. It's a total different philosophy in our view of seeing human beings, because we've been if we always treat humans like machines, like yeah,
It's true.
forget about the interaction between a human being and their environments, then because there's so many message, especially for a birthing person. There's so much more they're opening their sensation. I know these are for Doula 101s, but for many obstetricians, they just like what you're talking about. Yeah, why should we be doing any dimming of the lights? Why should we be talking softly or like they don't have that idea.
It
But
gets
yeah,
more like
being in
mechanical, right? I feel like when it's mechanical, you don't realize we can scientifically prove that your physiology reacts to your psychology, right? If you see, and when I was talking at ACOG last year, and I told them when I was talking about it, I said, you just walking, I mean, white coat syndrome, like you walking in with your white coat, it's not your fault if that causes someone's to freak out like there's a tiger chasing them. It's not your fault personally, but it is your responsibility to be aware that just you walking in the room could slow down the process. So how can you use that knowledge to change your way of being, right? There was an OB, one of my favorite OBs. He always like takes off his shoes and like very quiet. Like it actually sometimes scares me because I don't know he's there, but he's so soft and gentle. And then he's like, when he waits till the contraction's done and he's just so loving and gentle to the parents. And you can see those births going better because they feel safe. It's like, it's such a simple, it seems simple, but it's very profound versus flipping on the lights and everyone coming in and talking in the middle of a contraction, right? It's like little things can really be profound. So I bet you're doing more than you even realize to your families just by your awareness and like of their humanity and their physiology and their psychology and how it all works together in this really cool dynamic physiological event we get to support. It's so cool.
Yeah, that's something I really want to do. I mean, I am really doing it, like being immersed in the birthing room and 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 because people still putting on the white coat still kind of affirming sometimes for the families.
Oh, for
So I
sure. They can
think
feel safe. Yeah,
yes,
I feel that.
yes. So that's the part I want to um that's the part I want to be supportive to the whole birthing group, but without being controlling or dominating everything. But yeah, a trustable person that's part of the team, and I am providing medical support that
Which
I
thank
that had.
goodness. Yeah,
Um,
like again, thank goodness we have OBs. I feel like sometimes it's like, here's the doulas, here's the midwives, here's the OB. You know, it's like we're all in our own silos doing our own things. And it's like we all need each other. Like I am so grateful for you because I don't want to and I don't know how to do cesareans or I don't know how to do a lot of things that are life-saving and so important. And when someone's having preeclampsia, like we need you. Like we don't need me. I mean, you need me in a different way, right? Like I've supported many of those births, but like that's the beauty of this work is like it's not like there's no hierarchy. It's like thank goodness we're all here as a team working together. And I think like when and that I think that's one of the things why in Body Ready Method it's not just a doula training. It's not just for nurses. It's not just for doctors. It's like anyone who works in this space should have access to awareness and knowledge about the physiology and the soft tissues and the biomechanics and we all use it in different ways, right? Like I might suggest things and you might do different things just based on your scope with that knowledge. So I'd love to hear, so you took our pro training. So how has that helped you with your just your practice and what you do?
yes, yes, that's a great part. It's really amazing. It provides me languages. I mean, for people like because in Taiwan we're kind of the first group that collaborate with all multimodalities in supporting a birthing family because of yeah we incorporated traditional medical doctors and they are specialized in like orthopedics and traumatology. So and especially it's quite special that their trainings is somewhat it's somewhat connected with the martial arts. So
Wow.
they like yes, so like they have been doing the martial art training and doing the traditional Chinese medical training at the same time, and it's really cool. Yeah, that specific people, a group of people we've been cooperating with, and so they developed those very sensitive, very delicate tactile sensations we often found in PTs, and like they have they can palpate the tension lines and the tail bends, like all those delicate tactile sensations. But we're like, what you're talking about? Like the training OB/GYNs, what?
Yeah, they're like, what are you
So
talking
just
about? Movement? Massage? Like what? Yeah.
right, right. And what you're telling me that you're adjusting this or releasing that through this or that manual therapy, like it's
Yeah.
like okay, I really need sometimes we need sometimes yeah. So through these 3 to 5 years, like we've been working together, and they started to show us like how to observe and like assessing as a certain client and how they are seeing their the tension lines and how things are going. But because the language they're using are not mainstream Western medicine, not that anatomical. So yeah, so I really want to, at the beginning, before I met BRM program, I really want to join the martial art team so that I can develop those sensations and try to, yes, and yeah. But later on, and of course, it takes years to develop. So when I later on meet this BRM Pro project, I feel like, wow, this is something I really need as an OBGYN. I need these knowledge system, need this language system that that works as a bridge to, yeah, communicating not only just between me and the clients, because we know that when our clients are compensated already, they don't really feel what's in their bodies doing, but we can show them somehow. Or and especially on the other end, when I'm trying to communicate with my colleagues, with other physiotherapists.
You were talking about, like, I was really loving hearing about the martial arts and like how you're now it's like you found the system through BRM, and it sounds like, you know what, I would be fascinated. It would be so cool to like see the movements they're doing, because I would be willing to bet that it's very like it's there's some overlap and similarities, because it's like the intuitive movements of the person giving birth often like inform our our curiosity, right? Of like, oh, maybe it's this. So I don't know if you've noticed that, or I don't know.
Um, in terms of observing the, you mean the martial arts?
Yeah, so they're
Between the
doing
martial
like
art
birth.
and
They're
giving
bringing
birth.
it into the birth room, right? Like the martial art kind of movements. Or how is that? How do you see that like working? Or how do you see it like blending with what we do?
I've seen, I did see a specific a special traditional medical doctors, because she practiced martial arts herself. So in her birth, she did that. She did practice in a martial arts way. So, but that's her way of finding the flow of her
Oh,
body,
that's so
like,
cool.
which,
Yeah.
yeah,
It's
that's
just
so
like,
cool. That's
oh.
so beautiful.
It's like allowing, it's like a way of being embodied, right? It's like kind of like yoga people use, or it's like you're using martial arts to like find your center and your peace.
Mm-hmm.
That's so beautiful.
Yes.
I would
And I
love to
think that's a
hear. Oh yeah,
way.
sorry, go ahead.
Yes. Oh, sorry. Because the martial art part is the way that our traditional medical doctors, they used to like sharpen their senses, all five senses. So when they do their body works, when they contact with the clients, they have so many clues on them, and
So cool.
in very, yeah, in many different ways. So yeah, so I was talking about how BRM really give me a knowledge and language, the system to really, okay, um, I like some of the posters, alignments, and now they have names, like maybe I have seen them uh, a model by our clients, by our medical doctors, traditional Chinese medical doctors, um, but I don't know how to describe them. And they trace those tension lines on the client's body, but they're not necessarily that familiar with all those biomechanical or anatomical languages. So it's, yeah, so there's still a gap between their finding, their tactile findings, and how they describe them. Yeah,
Mhm.
but
But it's coming.
yeah, they're
That's
already
so
masters.
amazing.
Yes,
Yeah.
right.
There is like the shift. I feel the shift is coming in Taiwan. That's so cool. So I would love to hear just like final words of wisdom to other, you know, like doctors maybe listening, or midwives listening, or just anyone in this space. Like, what has helped you the most through your journey? I mean, it sounds like just your curiosity is a huge piece. Like you're like really pushing forward. But is there anything that you wish you knew, or you wish someone had told you early in your career as a doctor?
Well, Actually, I think the BRM point of view, starting from biomechanics and biotensegrity, this should be a part of our medical education.
Yeah,
I mean,
yes.
yes, this should be a part of that. And even it's not in the medical education, it should be part of the training program, or when or the or we don't have formal doulas in Taiwan, but I believe this is something you better be training your eyes to be doing, accompanying all your clients, because this is really body work. I mean, birthing is really a body work. It's no less than marathon, no less than a mountain climbing. It's you really need to use our body, but it's not consciously used, but you need to follow how your body is guiding and leading and yeah,
I love
evolving
that.
through.
Oh, I
Yes.
want you, like, we need every OB to listen to your words, like, so much wisdom. I love seeing, like, you're taking things and you're running with them and you're shifting things in your local community. So thank you, Jade, for being here, for being a BRM pro, and I'm just excited to see how you continue to shift things. So thank you.